So I've been reading medical studies with medical jargon that when I was a kid that I didn't understand. But the more I started to understand of how and what governs them, it makes it easier for me to understand maybe the efficacy, or how likely it would work in the real world, how effective it could be of that procedure, of that medication. So it's beneficial as a layperson to understand what and how is governed as well. Okay, as a professional, it makes you understand of how viable that study is you're reading. Is it really worth it? Like I had said a few minutes ago, is it really worth it? Is it something that they didn't follow protocol or procedure? So now you have to question how reliable this study really is. Okay. So that was number one. And that was looking at testing. Okay, so human and I talked a little bit about animal testing and who governs it or regulates it. Now we're going to talk about vaccines. I'm not going to go into what vaccines people should have. I'm not going to go into what people should do or shouldn't take. This was never intended, the information given through disease forensics or this segment of World War Z and public health was never intended to be a place to get medical advice. Okay, it's a forum. So I am not going into specifics about which disease, about which vaccines, no vaccines, whatever. But I will tell you this. I'll give you my personal opinion about vaccines. I believe personally and professionally, and I can speak professionally in veterinary medicine, it is absolutely imperative that people and pets and livestock all have their necessary vaccines. I think it's absolutely imperative. We have cured and rid our planet of diseases that many of us would not be alive or here today if it wasn't for vaccines. Okay, unfortunately, some diseases have started to come back. One we've struggled with is polio. We start to closely, I'm talking about planet level, we get very close to saying that we are completely eradicated it, and then there's a break usually in somewhere that some part of the world backs off from administering the vaccine, and then we have an outbreak. Unfortunately we've gotten close, but we've gotten rid of a lot of places like the United States, so vaccines are imperative. They are incredibly important. And we talk about such as airline travel that can affect disease transmission, and that I commented before, I could go out right now and buy an airline ticket and in 24 hours be somewhere on the other side of the world. That means that if I'm carrying anything, I can take it there, and it means if I pick something up from there, I can bring it home. So in light of that, vaccines are imperative. They are incredibly important. So that's my personal and professional opinion. But as far as it goes for vaccine specifics of what you should have, you should definitely be having a conversation with your general practitioner, whoever he or she may be. The health department is another direction you can speak to. Veterinarian for your pets, that's another direction you can go to, but I'm not going to be giving you advice on specific immunizations, okay, or vaccines. But the one thing I do want to talk about for a minute is herd immunity. So H-E-R-D, herd is in a herd of cattle, okay, so herd immunity. So what is that? Well, herd immunity has to do with the fact of having the majority of people vaccinated within a community to help keep those safe who cannot receive vaccines for whatever reason. Whether it's their health, like HIV, AIDS, cancer patients, their age, maybe they can't get it at a certain age, but their immune system, because of, we'll say, infants, makes them more susceptible. Maybe it's with pregnant women, depending on the disease that makes them vulnerable. So we're talking about herd immunity is focusing on getting as many people vaccinated as possible to keep those that are vulnerable or that cannot be vaccinated safe from the disease. And I can tell you, I've had various vaccines myself because I've traveled to different areas of the world, but I cannot have the flu vaccine. I was told, without going to specifics, because I don't want to inadvertently give anybody medical advice, I'll say it again, you should be talking to your doctor. But I was told because of, I've had 2 generations in my family of having a reaction to it, an anaphylactic reaction to it, that I, in turn, should not have the flu vaccine. But I've had all these other vaccines and have never had a problem. So I rely on other people being vaccinated for the flu, which we do not have the levels at all of people being vaccinated for flu. And I'm going to give you those numbers for a minute, specifically like where I live. So unfortunately, relying on that for that vaccine for me is not good. But if it's a child that hasn't been able to get their full MMR, measles, mumps, and rubella vaccine because of treatment for cancer, then they to keep them safe means the other children at their school or other children in their community, other children at their church, other children at the library that they go to, these places they visit, hopefully they've had a high percentage of children that have been vaccinated, so it keeps those kids safe. So herd immunity is really important. The best analogy I can give of it is, whenever they show, especially in the old westerns, like cattle, and they show that the older adult cattle are around the outside of the circle, and on the inside are the babies, basically the calves. So if we're looking at our community as that herd, then the people on the outside, the adult cattle, are those that can be vaccinated, and the ones on the center are those that cannot be. Okay, so if those on the outside of the circle can be vaccinated and they are not, then the ones will be vulnerable that are in the center. Okay, so herd immunity is a really important part of keeping a community healthy. So one of the information I want to give, this is actually through the Michigan Department of Health and Human Services. So this is our health department for the state. This is their quarterly report. Okay, so this is a report that you can print off for any county in Michigan. I'm in Mason County, and it will tell you what the vaccination rate is for the area. So this was actually last updated this past June 30th. There are 84 counties in the state of Michigan, and out of 84, we are ranked 41, not good, in flu coverage. And we're ranked pretty well with waivers. We don't have a lot of people doing waivers. However, with those ages 13 to 17, we're ranked number 36 for vaccines, for being up to date in vaccinations. And those 19 to 35, we are ranked number 15. And this is just in the state of Michigan out of 84 counties. So the areas that stand out on here that we are definitely not where we should be. So typically, the government says, hey, we're going to tell you a threshold that we're hoping, a saturation of people vaccinated that we really want for an area that we should be shooting for. Sometimes it can be low, as low as 70%. Sometimes it can be as high as 95%, depending on whatever you're vaccinating against. Okay, so the threshold for that community or saturation depends on, can be factors like how contagious something is, if it's endemic or part of that area, the age of the area can have an effect on it. So there's a lot of things, variables that are put in there that help determine what that threshold needs to be. So in this case, we have for infants 19 through 35 months, okay, we have a Hep A 2+ combination vaccine, where they specifically, their goal is 85%. The 85% should be covered, and we are at 65.6. Okay, so that vaccine, we are about 20% under what is recommended by the health department for our county. When I look at the flu vaccine, and I had said that we rank 41st out of 41st out of 84 counties. They would like for those 18 plus years, they would really like a 70% goal of the persons vaccinated, and they have it at 36.7. So we're about half. We're about half the number that should be receiving the vaccine receives it. So that would mean that as far as herd immunity for flu, which would be for most counties in the United States, that really varies from region to region, we would not do well with that. And then we also have concern here, for infant vaccines, that we have vaccines that infants have not received. Okay? So, what am I leading up to here? Okay. Here's an article. So I have an article here. It says kids in these U.S. hotspots at higher risk because parents opt out of vaccinations. Okay. So there's the article. So kids in these U.S. hotspots at higher risk because parents opt out of vaccinations. And this is by Lena H. Sun. She's with the Washington Post. And this was published on June 20th of this year. So June 20, 2018. It says 18 states allow parents to opt their children out of school immunization requirements for non-medical reasons, with exemptions for religious or philosophical beliefs. And in 2/3 of those states, a comprehensive new analysis finds a rising number of kindergartners who have not been vaccinated. When I think of what kindergartners do, sticking their fingers in their mouth, touching their eyes, a lot of them pick their nose, touching all these things, and then that they don't have their full vaccines really surprises me. Okay. So among the counties where more than 400 kindergartners received non-medical exemptions in 2016 and 2017, the 15 metropolitan locations with the most exemptions, so we're talking about people that were non-medical. So these aren't children that have cancer or some other illness or immune system issue that it was deemed medical that they should not be vaccinated. These are choices. Okay, choices the parents are making to not vaccinate their kids. So these are areas, these are the 10 areas that are the focus of where these hot spots are at, okay? So the most exemptions were in Washington were Seattle, Spokane, and Tacoma, Portland, Oregon, Phoenix, Salt Lake City and Provo, Utah, Houston, Fort Worth, Austin, and Plano, Texas, Detroit, Troy, and Warren, Michigan, and Kansas City, Missouri. Those areas are considered hotspots because they have higher numbers of exemptions, higher numbers of parents choosing not to vaccinate their children. Okay, so the high numbers of exemptions in those densely populated urban centers. So these have a lot of people, guys. I'm talking about Detroit, Troy, Portland, Phoenix, Houston. I mean, these are areas that are densely populated, okay? So the high numbers of exemptions in those densely populated urban centers suggest that outbreaks of vaccine-preventable diseases could either originate from or spread rapidly through these populations of unimmunized, unprotected children. The authors conclude in the report, many communities are in cities with busy international airports, further increasing the risk of disease spread. When I read that for Michigan, all of those, Detroit, Troy, and Warren are very close to Detroit Metro Airport. So you're not just talking about that if they travel with their parents, but anyone traveling from those areas, they go through there. Not good. The 3 states that have banned non-medical exemptions are Mississippi, California, and West Virginia. So those 3 states have said you can't exempt. You don't have a choice. That they're saying non-medical, okay? That you don't have a choice to say, well, I just don't want for some reason to give my children these vaccines. You can't. Well, they show the highest MMR, so that's measles, mumps, and rubella. They show the highest MMR vaccine uptake and the lowest incidence of vaccine-preventable disease. So those places, Mississippi, California, and West Virginia, have the lowest rates of vaccine-preventable diseases because they do not allow exemptions. Okay? After the 2014-2015 Disneyland measles outbreak was linked to a low MMR vaccination rate of children, California state legislators sought to increase vaccination rates by eliminating philosophical exemptions. In just 1 year, vaccination rates increased. Really think about that for just a moment. So your child is not vaccinated for MMR, and you visit a place like Disneyland where tons of people visit every year, okay? So the statistic I want to tell you is approximately 16 million people a year visit Disneyland from all over the world. So if you're not vaccinating your children and you're visiting somewhere like Disneyland, and they come from an area where measles is, for instance, is very prevalent, and they come to Disneyland and your child's there unprotected, you've got a problem. And that's exactly what happened in 2014 and 15. There was an outbreak from Disneyland that was linked to an international traveler. Okay, we're going to talk about that in just a moment. A child with non-medical exemption from the MMR vaccine is 35 times more likely to contract the disease as a vaccinated youngster. Studies have shown. A 2016 study found a neurological disorder that is a complication of measles, killing children years after they've been infected, is more common than previously thought. The disorder lies dormant for years and then is 100% fatal. Researchers do not know what causes the virus to reactivate, and there's no cure once it does. I'm not surprised they find this later, because we found this out with chickenpox, right? That connection was not made. I didn't hear about that connection at all when I was a kid. As a matter of fact, when I was a kid, there wasn't a vaccine for chickenpox, and parents were still having chickenpox parties. You know, bringing children together in neighborhoods so they would all get chickenpox at the same time and get it put behind them. And then we find out later all the awful things that can come from it. These children, it's rare, but they can die from it. And then the issue are adults and what they develop from that virus later on. That wasn't a talk of. So now we have with MMR that there is a 100% fatal disease that's from measles that can resurface later as an adult. You know, so that's pretty significant with that vaccine, and it just simply can be eradicated with a vaccine. So there's something I want to bring up with that. You know, like I had said with travel, right? With how, and I used Disneyland as the example. If you've been watching this disease forensics Facebook page, Italy has been having one heck of a debate over vaccinations. And they decided to remove their law that required vaccines, like similar to what our laws are here in the United States. The problem is now they have a measles outbreak. And I know it was in the hundreds, it could be in the thousands by now, because it was really gaining quickly. We'll just keep going. It was really gaining quickly, so the hundreds could be thousands at this point. So imagine the fact of you have a country that does not require vaccines. Okay, does not require vaccines. Well, Italy has approximately 50 million people that visited there in 2017. 50 million, and I'm talking from all over the world. So if it's another area of the world that doesn't require vaccines, or if it's like here, that if a parent was able to get an exemption and not vaccinate their child for MMR, and they visit Italy, not only are they potentially picking it up, but they're bringing it back here to the United States. And it could be an area that we typically didn't see measles in the U.S. And then, especially if it's an area where a lot of people are not vaccinating, right? Area like a hot spot, like I mentioned, there goes herd immunity. So the kids that are vulnerable within that area have a potential for picking it up too. So there's a chain reaction to this. Absolute chain reaction. So if we're speaking about measles specifically, it says, and this is actually from the CDC. This is from the Centers for Disease Control on measles. Let's read this first. So what is measles? It's highly contagious. The virus is found in nose and throat mucus. It's spread through coughing and sneezing. It can live up to 2 years, or 2 years, that's not true, 2 hours in the air. So if I was to sneeze or cough and I have measles, it can stay in the air for up to 2 hours, okay? It can be spread 4 days before to 4 days after a rash. So the telltale sign of measles is the rash. It is contagious for 4 days before that rash shows up, and for 4 days after the rash. So there's a pretty big window, significant window there that it can be transmitting measles. So the symptoms of measles generally appear about 7 to 14 days after the person is infected. It includes high fever, cough, runny nose, and red watery eyes. 2 or 3 days after symptoms begin, these tiny white spots called Koplik spots appear inside the mouth. 3 to 5 days after symptoms begin, a rash breaks out. It usually begins as flat red spots that appear on the face, at the hairline, and spread downward to the neck, trunk, arms, legs, and feet. Small raised bumps also appear on the top of the red flat spots. The spots may become joined together as they spread from the head to the rest of the body. When the rash appears, a person's fever may spike to more than 104 degrees. After a few days, the fever subsides and the rash fades. And that's if there's no complications that occur, because complications can occur from measles. They can get ear infections, diarrhea, and some people, when they think of diarrhea, it's like, well, what's the big deal? Dehydration. Okay, whenever we talk about diarrhea, typically it's because we're concerned about secondary issues, which would be the dehydration it would require, especially as a child. Okay, so some people may suffer from severe complications such as pneumonia and encephalitis. And encephalitis is a swelling of the brain. So as many as 1 out of every 20 children with measles gets pneumonia. 1 out of every 1,000 develops encephalitis. And children actually die from measles. So this is a pretty big deal. Not having vaccines for something like this, that's easily transmittable. When I think about something that can be in the air for up to 2 hours, that's a little frightening. Especially when you talk about the cases like that we just had a week ago. Southwest Airlines had four airplanes, 4 flights that had a person on there that was measles positive. So the CDC was contacting people to let them know, hey, you need to watch for these signs, and are you vaccinated? Because of a person that was on those flights that did have measles, okay, that was contagious. So it's a pretty frightening thing, especially when you know that if you give it to someone, like I say in herd immunity, if you have anyone in your family that is unable to have the vaccine because of some sort of illness, adult or child, that's a pretty scary situation. So far in 2018, 124 individual cases have been confirmed in 22 states. And that number is actually a little bit higher now because Pinellas County, Florida is having an issue where they're having a small outbreak. And they believe it was transmitted from someone traveling from internationally coming into Florida. So that number is actually a little bit higher. But so far, we've seen positive cases in Arkansas, California, Connecticut, Florida, Illinois, Indiana, Kansas, Louisiana, Maryland, Michigan, Minnesota, Missouri, Nevada, New Jersey, New York, North Carolina, Oklahoma, Oregon, Pennsylvania, Tennessee, Texas, and Washington. That's just this year that we've had positive cases in. Okay. So the majority of people who get it are unvaccinated. Measles is still common in many parts of the world, in Europe, Asia, Pacific, and Africa. Travelers bring it into the U.S., and it can be spread. Measles can be spread when it reaches a community in the U.S. where groups of people are unvaccinated. Like I said, that is a huge concern. And the outbreak that I had said about with Disney World, that ended up infecting 667 kids. So, again, when you talk about someone who could have it, that could be, you can't take your child out of the community. If they're not vaccinated, anywhere they go can be a potential risk. The vaccine helps to mitigate that risk or dramatically lessens the likelihood of that child picking up that illness because that child's been vaccinated against it, right? So vaccines help us to mitigate or reduce the likelihood of transmitting a disease. So in veterinary medicine, we definitely see a concern with pet owners choosing not to vaccinate their pets. And the anti-vaccine or or that idea has been in veterinary medicine for a long time from pet owners, that I've heard pet owners say they don't believe in it. Even some trying to buck at getting their rabies vaccine. And there are some options, for that if you choose not to do a vaccine that the law does allow, such as some places allow for titer testing. So if your dog is at a certain level that shows that, that their titer for rabies vaccine is a certain level, then they can skip a year. But that's not cheap. You're having blood work done and you're seeing what is the level of the titer of the rabies antibody in that dog's system. But parvo in dogs is something that we see, my gosh, rather frequently. And it spreads so easily. They can pick it up from wildlife. They can pick it up from other dogs. And there's always a concern, even though we have vaccinated pets at home, I was talking about those of us that are in the veterinary profession, we're always concerned about bringing it home on our clothes. I mean, this is a real concern. There have been many times, the different clinics I worked at, where I was helping to treat a rabies or parvo positive dog, and I had to change my clothes at the door. I was not even going to bring my clothes inside the house because it can be transmitted off of my shoes, my clothing, and my skin. So it's easily transmitted, very, very, very easily transmitted, and that's something we definitely see pockets of that flare up at different times of the year. So parvo is something that's usually part of a series, DHPP or distemper hepatitis parainfluenza and parvovirus, or DHLPP, which just the L stands for leptospirosis. So it's usually part of those other groups of vaccines that really are imperative to keeping your pet healthy, because I can tell you a lot of the dogs that encounter parvo do not make it. And it's not the actual virus that kills them, it's the dehydration that does it, because it causes a copious and massive amount of diarrhea because of how it affects the GI tract, and in turn it causes awful dehydration as a result. So it makes much better sense to vaccinate your dog for parvo than having to deal, even financially, because it's expensive, than having to deal with the aftermath of a disease. And vaccines are they're an interesting subject, and I'm speaking a little bit more with veterinary medicine about this because that's my background. You don't just give a vaccine. There's certain times you have to give it that are optimal, especially when you're talking about with puppies. Some vaccines require a follow-up or a booster. Others do not. Some you just give once a year or once every 3 years. Others you have to work up the immunity, and then you can continue booster it, then you can continue it after that. Why do we do that? Well, I could tell you with puppies, the big concern is up until a certain age, the puppy basically continues to have immunity that was given to them by their mother. So what we look at when you talk about, well, we really need to give vaccines between 6 and 8 weeks, we're talking about that this is when the immunity starts to wane a little bit. So then that's when we give the first vaccine. And then we say, okay, at this point we're going to give another vaccine. So the immunity increases from the vaccine, and we know it's going to drop again. We give another vaccine because we want to make sure that animal's body, their immune system, is going to replicate that virus or whatever we're vaccinating, bacteria. So in the case of Lyme disease, if it was an adult, that they're going to recognize, their body has to have enough of that puzzle piece in their system that to recognize that they've come in contact with that disease, and so that their body instantly attacks it. So it's really interesting to understand when those vaccines are provided that you just simply aren't giving a shot. You're giving an injection of a part of an illness. So it needs to be given a certain amount of times or at certain points of that pet's life to ensure optimal protection against whatever the disease you're vaccinating against. Rabies, something I want to bring up with vaccines, because we can get vaccines. I've been vaccinated for rabies. Anyone in livestock, you should be vaccinated for rabies. If you work with livestock, you should be. Cows can contract rabies virus. So those working in livestock should be vaccinated for rabies. Of course, people that work at veterinary clinics, grooming facilities, training facilities, all of us should be vaccinated for the rabies virus. But there's something I want to bring up too, that we know that certain animals are more susceptible in wildlife to getting rabies, and one of them are bats. If you live in an area that you have a bat that gets in your home that can be a regular event, make sure you contact your health department to decide if you should be letting it go. That policy has changed in many areas of the country. Bat bites are incredibly small. So if you have someone in your home that's incapacitated, you're taking care of an elderly individual, you have young children, or even overnight, a lot of places recommend it because if it was to bite you in the night, you may not even know it. That's how small the bite is. And the bat bite in your home, a lot of the health departments recommend sending him for testing and not to look at it, to throw it back outside. When I was a kid, that's what you did. So make sure you contact your health department to verify what you need to do. Okay. It used to be that we could gauge, they go, oh, well, we're trying to figure out what diseases are endemic by the animals in an area that could be transmitting the disease. Well, how do they figure that out? Well, what wildlife we test, raccoons, for instance. And we used to be able to tell when I was a kid, and I'm talking about very young kid, because I became a licensed wildlife rehabber at 16. That's 1996, and that changed then, around that time. But if a raccoon was out during the day, they would say that's not a good sign. That's not true anymore. That was true at one time, that they could be looked as a sentinel animal, that that there's rabies in that area because we're seeing raccoons out more frequently. You can't tell that way anymore because opportunistic feeders, such as raccoons, have a tendency to be out whenever they're going to get a meal, right? If I'm putting out my trash can at 10 o'clock in the morning, then all of a sudden they're no longer, they're losing their nocturnal, their diurnal. They're out during the day. So there's no way, it's not the same anymore. A lot of these urban wildlife, these animals that we find in suburbs and cities, they've adapted what would have been their normal wake-sleep rhythm is adapted to when that food's going to be available. So we can't tell that anymore. So because of that, it makes sticking to the law of vaccinating your pet for rabies even more imperative. Because there's no way for you to tell by what you're seeing out and when of whether the wildlife in your area, because there's wildlife in cities, of whether the wildlife in the area could have a disease. Okay, so it brings up an interesting point about vaccinating our pets, because the one thing I do encounter frequently are people that say, well, I don't have to vaccinate my pet because, see, I never let him outside. Look what's happening right now. Right now, we are looking at Hurricane Florence hitting the East Coast, okay? And if you're one of those people that are evacuated, I'm imagining you're taking your pet with you. I hope you're taking your pet with you. And what if you do not have vaccines? If you end up in a shelter that has other pets there that aren't vaccinated, you're giving them one heck of an exposure. They're going to be stressed as it is. They're around people they don't know. Their routine has changed. They may not be on the same food. So their immune system could be affected as it is. And then you're exposing them possibly to pathogens because they're not vaccinated. So don't wait until an emergency happens. This is one of the reasons why we try to make sure our pets are up to date in vaccines. It's not just because we don't just keep them in the house. It's because if God forbid something happens that we are not in our home, what are we going to do? And in cases like natural disasters or emergencies, now you could be exposing them to more diseases. Okay, so that concludes our second one. So we hit, the first one was testing, human animal testing. We talked about vaccines, and now our third is public health. And I'm not going to talk too much because we're going to finish this last part of the segment on public health. But, in the movie, one of the best parts to me that I hope you're picking up from it, if you're looking at it from a public health standpoint, look at all the people involved. Look at all the people involved. You've got military, you've got the UN, you have locals, you had that CIA double agent guy, right? You have foreign health officials. There are a lot of people that need to work together to keep a community healthy. It is not just a person or a profession that does that. And that, I always tend to go the direction of One Health, that it's animal, human, and environmental. But I really want you to even go with a wider scope than that, because I've given the example of schools. Schools that decide to close down because they have a flu virus that's going through them. That's something with public health. You're trying to delay or reduce the likelihood of that virus being further circulated within a community, so you decide to shut down your school, for a few days, so you can clean everything and allow kids to stay home that are sick, that should not be going to school. That's public health. You're a cashier at a grocery store, and if you're not able to wash your hands as much as you like, you decide to use the hand sanitizer. That's public health. We all have some part of it or some stake in keeping ourselves healthy, but the people that we come in contact and interact too. So we're going to talk about how public health is in your area, but there's one thing I want to mention real quick. So September 28th is World Rabies Day. You can look up information through the Global Alliance for for Rabies Control. So it's a Global Alliance for Rabies Control about what could be going on in your area that could promote rabies understanding and direction for vaccination, not just for animals, but for people. Okay, so again, World Rabies Day, September 28th, and you'll see me posting for things on that too. So this is what I want to bring up here. So here we have the Public Health Coat of Arms. Okay, so we have a syringe, which represents medicine. We have an eyeglass that represents sleuthing, right? And not just as a professional, but as people keeping our eyes open for disease. And a microscope, which is confirming, diagnostic of a disease. So what would we have on our public health coat of arms? Well, we're going to be relating this to World War Z, okay, and what we've covered. And this is what I'm going to do in the future too when we do the public health, Hollywood and public health, the public health in Hollywood. So I'm going to pull out 4 themes, 4 subject matter from what we've talked about, and I'm not going to go into great detail. We're just going to quickly revamp it. So, how do we react to emergencies? This has a lot to do with our coat of arms for public health. Are we prepared? Are we vaccinated? Do we have a plan? I've suggested ready.gov for lay people, that you have a plan for your family and your household. But municipalities, are you ready? Do you know what diseases can affect your area? What if your water supplies go down? What do you do as a municipality? People need to be aware of how to handle for emergencies. Don't look at it, it's not going to happen here. In Michigan, we do not typically get tornadoes. We don't see them. But you know what? 2 weeks ago, we had 5 of them. 5 of them in the same week. What would happen if in an area that we just didn't plan? Because we don't get tornadoes in Michigan. You need to be aware of what potential and have a contingency plan for your contingency plan. I brought that up before a few segments ago. So be aware of how you would react to emergency. What resources, what trained personnel do you have in the area? Think about those things as a municipality. As a layperson, have a plan. Does everyone in your family know about a plan? Do you have an elderly person that's in a nursing home or adult foster care facility? Then you need to find out if they have an emergency plan too. Don't assume that they do, because they need to be included in your emergency plan. Okay? So what's another public health coat of arms? See something, say something. You see something that doesn't seem right, open your mouth and tell somebody. No government body is going to be upset because it turns out it's not contagious. It's not going to happen. They're going to be relieved and they're going to think, God, it was not a big deal. Okay? So you need to make sure that when you see something, you say something. As a livestock owner, be aware of what normal health is for your animals. What does normal look like? Because especially with animals, and not just livestock, but our pets, we see behavior changes first. We know something isn't right. Maybe their favorite treat they no longer have interest in, or their food. So we see things ahead of time. As a professional, are you encouraging people to come to you? You know, are you saying, come to me when you got questions? Oh, you're unsure? Ask me. Health department, are you encouraging people? What are you doing? Are you going to health health forums, places where you can openly discuss with people about disease, about what to look for? Are you using trained personnel? I mentioned about using licensed wildlife rehabilitators. They're trained. Use them as a resource for getting information like about rabies, distemper, and other diseases that can both go between pets and wildlife. Okay? See something, say something's imperative, and it's a cheap way. Government, you're trying to save money. Use people that are already trained. Lay people, use your government programs are already paid for. Talk to them. You have concerns about it. Okay? So what else do I add for my coat of arms from things that we've talked about in the movie? What attracts disease? If I want to maintain health, I have to know what to avoid, right? I mentioned about hand sanitizer. The Centers for Disease Control and Prevention recommends that to properly wash your hands with soap and water, that you need to do so for 20 seconds. That's if I was to hum or sing the happy birthday song twice. Okay? Are you doing what you can? Are you washing your hands? Do you have hand sanitizer with you? That if you cannot wash your hands right then, that can be a good way that you do until you can. Are you sick? Are you sick? Do not go to the movies. Don't go to work. Don't go to school. We should not be sending ourselves or our children to places that we know when they're sick where they could be making other people sick too. Remember herd immunity. It's not just about those that are vaccinated. It's about those who cannot be vaccinated. So we need to act on that too. What attracts disease? You know, so hand washing. Make sure we're washing our hands. Make sure that we're not going out when we're sick. Make sure we're seeing our doctor. Don't sit and wait until you can't get yourself out of bed. You know, talk to the health department on your concerns. Are you up to date in your vaccines? Especially if you're traveling. Are you up to date in your vaccines? Don't bring something home, especially when it's not even from the United States, right? Introducing a disease to the U.S. when we don't have an immunity against whatever disease you could be bringing back. Okay? And the last one, which we're going to talk about, that I said we briefly mentioned here. What is public health in your community? You know, this is really understanding in our communities of what areas can we transmit disease, acquire disease, and how we can squash disease. Know your vaccination rates. I looked this up through the health department, Michigan Department of Health and Human Services, and I looked up my rates for Mason County. That could be beneficial for me, especially if I'm undergoing cancer treatment or something where I'm going to have immune system issues. Because I would know if I'm in an area that, for instance, MMR, that measles, mumps, and rubella rate is very low, then I know that when my immune system's low, I probably shouldn't be going to many public places, especially places maybe like the library, grocery stores, okay? So be aware of the rates in your area. Who can you turn to for public health questions? Obviously your general practitioner, but don't forget your health department. The money's already mandated from the government for them. Utilize them. Utilize them. Find out what services they offer. What can you get from them? You know, you really need to do that. You know, find out from your hospital what they offer. A lot of them have health forums and ideas that are health forums, seminars, and most of them are free. You know, that they say, well, we'll do a blood pressure check and then we'll talk to you about diseases in the area. That's the kind of stuff you should be taking advantage of. You know, absolutely. And I'm going to throw my 2